Hey there, everybody. My name is Dot Pennington, and together with my fellow nurses that I've just introduced to you, I'd like to invite you to join me in this video while we learn together about how to prevent HIV. To discuss prevention of HIV, we really need to discuss some other topics as well. So in this video, some things we'll be talking about today will be the etiology of HIV, risk factors of contracting the disease and how to reduce these risk factors, manifestations of it, what does it look like, adverse effects of the treatment and adverse effects of the disease, of course, different treatment options and complications. We're going to talk about promoting health in the student body, and of course, we'll wrap up with some community resources for y'all. HIV is a retrovirus that causes immunosuppression. It can be transmitted through contact with infected blood, semen, vaginal secretions, or breast milk. Transmission occurs through sexual intercourse with an infected partner, and once it enters the body, it attaches to CD4 receptors on the T lymphocytes and uses lymphocytes as a host to replicate. Some risk factors include having unprotected sex with multiple sexual partners, men having sex with men, and infants born to HIV-infected mothers. So HIV has 4 stages we can talk about, and the manifestations of HIV look a little different in each one. First, you have the acute infection, which is 2 to 4 weeks after you're infected. This feels like the flu. So it can easily be missed because of that, because people just think they have the flu. Next, you have the asymptomatic. This is 2 weeks to actually 8 years where you have no symptoms. And so if you don't catch it in the acute infection stage, you may not know for up to 8 years that you are HIV positive. Unawareness leads to continued high-risk behavior. So really, it's so important to catch it early. The third stage is the symptomatic stage. This happens after that 8 years. And this is also called the active stage, where you have things like persistent fevers, night sweats, chronic diarrhea, recurrent headaches, fatigue, thrush, shingles, yeast infections, herpes, and you can actually get Kaposi sarcoma or the Epstein-Barr virus. And then end stage is AIDS. And if this is untreated, your immune system becomes majorly compromised, and you'll have systemic infections and cognitive changes, and this is life-threatening. And really the major thing we're focused on today in this video, which I mentioned earlier, is HIV prevention. And so we really want to promote the student body population health and HIV prevention. It's really important to encourage safer sexual practices, which includes condom usage and early testing. We want you to voluntarily have access to HIV testing. We want this to be a routine part of healthcare. Also, prenatal appointments. We want to the student body to have access to free voluntary HIV testing as part of this routine care. And actually, we have a quick video from Nurse Steph to explain to you what a at-home HIV testing kit would look like, which you can get for free, which we'll explain a little later.
Hi, I'm student nurse Steph, and I'm here to show you what an at-home HIV testing kit looks like. Nashville Cares was gracious enough to supply us with a lot of the things that they give their patients in their very office. This is the OraQuick in-home HIV test, and let me tell you a little bit about it. What does this test do? OraQuick is an in vitro diagnostic home use test for HIV-1 and HIV-2 in oral fluid. This HIV test works by looking for your body's response to fighting the HIV virus, essentially looking for antibodies. There's rules that you have to follow when utilizing this test kit. Like, it has to be saliva that you utilize for the test kit, no other body fluids, etc. When should you use this test? So this is a test that you're going to use 3 months after a risk event. Using this test earlier than 3 months, since a risk event may not produce an accurate result, if you test within the first 3 months, you should test again 3 months after the risk event to double check. What is a risk event? Let me tell you. Sex with multiple partners, sex with someone who is HIV positive or whose HIV status you don't know, sex between a man and another man, using illegal injected drugs or steroids, shared needles or syringes, exchanged sex for money, having been diagnosed or treated for hepatitis, tuberculosis, or a sexually transmitted disease like syphilis. Okay, now let me show you what's in the box. When you open your OraQuick box, you will find the instructions. How to, properly go through the process of completing your at-home HIV test kit. How quickly will I get my results? You can get your results in 20 minutes after you start. Okay, then it has this little jar here that has your actual testing supplies. So here you have the test tube and the test stick, along with some more reading material regarding HIV status and the HIV testing.
Thanks, Nurse Steph. We wanted to touch back on some of the risk factors we mentioned earlier, and pertaining specifically to drug use. So we want you to know that the biggest risk for HIV-related infection is from using drugs, sharing equipment, and having unsafe sexual experiences while under the influence. And so some of the things I want to highlight here is do not share needles. And really decide not to use drugs. If that's not an option, some communities offer syringe service programs where you can go and get clean new needles on a regular basis so that you can eliminate this risk factor from your life. And always do not have sexual intercourse while under the influence of any drug, including alcohol, as it impairs your decision making. More on the risk factor of decreasing the risks of HIV infection related to sexual intercourse. We do have a quick video again from Nurse Steph to talk to you specifically about this point, but I'll cover just a couple things. Deciding not to have sex is 100% effective, and it's the most effective way to make sure that you won't get HIV through sex. Limiting risky behaviors, which includes mouth, penis, vagina, rectum, does not come in contact with a partner's mouth, penis, vagina, or rectum. Using condoms correctly. You can take PrEP, which we'll go into in just a minute, and that's a medication you take before a risky behavior. And get regularly tested and treated for STDs. But I'll let Nurse Steph talk to you more about this.
Some ways that you can protect yourself. The barrier method. I want you to use a new condom every time you have sex. This is the male condom. And we want you to use a water-based lubricant. It's important that it's water-based and not oil-based, because the oil-based lubricants can create friction against the condom and increase the risk that it breaks, completely eliminating the condom's effectiveness. By the way, it's like 98%. That's pretty damn effective. For oral sex on a man, again, you want to use that condom. For oral sex on a woman, you have options such as a dental dam. This one's grape flavored. So the dental dam goes over the vagina and it creates a barrier from person to person, from skin to skin. For people who are allergic to latex condoms, there are non-latex options like the plastic or polyurethane option. And lastly, we just want to say safe sex is great sex. It's best not to engage in, sex or sexual activities when you're under the influence, simply because your judgment is impaired, which increases the risk of unsafe sex. So gonna bring it all together again. Safe sex is great sex, and you don't have to limit your lifestyle, but you can protect yourselves. And yeah, have a good one.
Okay, and I just wanted to touch on the medication I mentioned before Steph was chatting with you about PrEP. This is the medication that you can take, and it's highly effective. And it's taken as a prescription, so you do have to get that from the doctor, and it's prevention against HIV before a risky event. Currently, there are 2 medications approved for this: Truvada, which is approved for male and females, and Descovy, which is approved for everybody except for people assigned female at birth who are at risk of getting HIV from vaginal sex. So PrEP is for people who currently do not have HIV but are at risk of infection, and CDC recommends these 2. Remember, it's Truvada and Descovy. Recommends these for people who are HIV negative, who've had anal or vaginal sex in the past 6 months, who've been diagnosed with an STD in the past 6 months, have a sexual partner with HIV, especially if the partner has an unknown detectable viral load, people without HIV who inject drugs, share needles, syringes, or other equipment to inject drugs, have not consistently used a condom, and have an injection partner with HIV. So I wanted to include this in here because this is a great community resource. There's 3 different places in Nashville here that will give you free access to PrEP, and you have to pay absolutely nothing for this. So one is Music City PrEP Clinic, and the addresses are on here, but I'll read them. Music City PrEP Clinic is 615 Main Street in Nashville. Another clinic is called Nashville Cares, and that's 633 Thompson Lane in Nashville. And then finally, Planned Parenthood in Nashville, and that's 412 Dr. D.B. Todd Jr. Boulevard. And the numbers are on here as well, so you can pause the video and write down that number and call to set up an appointment for those if you need to. So once diagnosed with HIV, you'll want to know what the treatment is for this. It's called antiretroviral therapy, ART for short. There's no effective cure for HIV, but with proper medical care, you can control it. Treatment should be started as soon as possible after the diagnosis. Any delay in this will allow it to continue to harm your immune system and get worse and worse. The goals of treatment are to maintain your T cell count, so immune function there, keep viral load below mutation levels and below the level of detection. Drug targets HIV proliferation at different steps in the life cycle, and adherence is key. These meds, you'll be prescribed a lot of different medications that have many interactions with other medications and at different times, and different rules about every single med. So adherence can be tricky, sticking to it, but it's absolutely necessary. HIV medications can be pretty tough on your system as well, but a little less tough on you than HIV would be. Some adverse effects are hyperlipidemia, insulin resistance, hyperglycemia, bone diseases, renal diseases, cardiovascular diseases, etc. When HIV is left untreated, it can progress to AIDS. And the diagnosis of AIDS is made when an HIV-infected patient meets the criteria established by the CDC, and this is the following criteria. The CD4 T cell count, remember we mentioned T cell count earlier, and when that drops below a certain threshold, which is 200, AIDS is a diagnosis at that point. Number 2, you'll have other infections along with that. So you'll have bacterial infections like TB. You'll have fungal infections, that's thrush of the trachea or bronchi and the lungs. You'll have protozoal infections or other viral infections as well that can be pretty serious. And one of the following opportunistic cancers. So yes, this can also lead to cancer. Burkitt's lymphoma, invasive cervical cancer. One of the bigger ones is Kaposi sarcoma. And then finally, you'll have wasting syndrome, which is exactly what it sounds like. The body kind of just wastes down. Wasting is defined as a loss of 10% or more of ideal body mass. I'm going to touch on these two main complications of HIV and AIDS quickly. I mentioned them in the last slide, but real quick, Kaposi sarcoma. It's a manifestation of the herpes virus. Purple, brown, painless lesions. It can be localized skin lesions to the lesions being in the GI tract and the lungs and the lymph nodes. So it can get pretty systemic. They may cause hemorrhage or infection. Then you have HIV wasting syndrome, which I did touch on again. This is uncontrolled weight loss. You just can't keep weight on. Chronic diarrhea, weakness, fever, and no other cause. Anorexia, diarrhea. And this occurs late in the disease process at the end stage. I'm not going to read through this all for you today, but one main thing to know here is that in Tennessee, the rate of HIV/AIDS has actually been decreasing, which is wonderful. And the number of people living with diagnosed HIV also continues to increase due to advances in treatment that improve health and prolong the lives. So that is the good news. And I have one more slide for you that I'm just going to put on the screen, which will have community resources on it. And you can go ahead and pause the video to write down the information that you would need from that. But thanks so much for joining us, and I hope you learned something, and good luck.